That we are joined once again by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19. Doctor, thanks for being here. We appreciate it. As always, good news today for communities with low levels of COVID cases. The governor announcing he's going to relax those restrictions for areas that have not been in the state's red category for at least 3 weeks. So let's explain them really quickly. New step 2 of phase 3 category will allow larger groups of people to gather indoors, maybe at a museum, a theater, a roller rink. Do you think it's a good idea, even with some cases rising statewide?
So, Maria, you know how I feel about indoors versus outdoors.
Yep.
There's a significant increased rate of transmission, but in Massachusetts, we are doing well. I think the governor is doing a good job of taking his foot off the brake slowly, pressing down on the accelerator slowly. The key is that we have to watch to make sure that rates of transmission don't increase. And remember, try to wear your masks indoors as much as possible.
And that's what I was going to say, Doc. You said that yesterday on the news, wearing the masks indoors. The governor also announced...
This is where transmission is going to be occurring.
There you go. The governor also announced retail stores in these lower risk communities can finally open their dressing rooms. So why were they closed in the first place? Have we heard anything about the risk of going into a small room like a dressing room or a bathroom after someone has been in it?
So we don't know specifically the risk in dressing rooms or bathrooms or even elevators, but overall it's probably lower risk because people aren't congregating in there, shouldn't be, and you're not spending too much time in there. So overall, I think it's lower risk. Also, we don't think that you're catching the coronavirus from clothes.
But you also used the word risk. You didn't say it was zero. You know what I mean? You said lower risk, you know?
We can never say zero risk, but for instance, we've seen outbreaks in buildings that have elevators that have only occurred on one side of one floor of the building. If elevators, for example, as a closed space, were a significant risk of transmission, we'd be seeing it in multiple floors. I think overall it's lower risk.
All right, quickly, Doctor, 15 communities in the red category. One of them is Nantucket. That's an island. As we know, the rest are wedged right between ones that are green, yellow, and white. So what's your advice to people as they travel even within the state?
So we've talked about this before.
Right.
You know that as mobility increases, there is increased transmission. I will always say, if you don't have to travel at a time like this when we're starting to see more individuals test positive, I think the best idea is to try not to travel and try to avoid those, hot zones or the parts of our community that are in the red.
Dr. Ellerin, it's great to have you with us as always. Thank you for your time.
See you guys.
Be well.
You guys are doing a great job.
Thanks.
You are too, Doc.
Thanks, Doctor. We always appreciate it.